love to always ask, first of all, how did you hear about ARPneuro and how long ago was that? And tell us a little bit about, that experience and how you integrated it into your practice.
ARPneuro was something that I was hearing about. There's a lot of information about it going around. And I was seeing some colleagues that I highly respect that were using it, that were finding a lot of success with it, like Dr. Jeremy Dinkin in New Jersey. And so essentially, once I got to try it out and through the trial period with the ARPneuro, we were seeing like immediate success, like really quickly. It was streamlining a lot of the different treatment methods and the management plans that we're having with our clients. And it was just like a no-brainer.
Tell us some of your first experiences early on with some wow me moments with the technology. What were you trying to help the patient with and how did it help?
I remember early on, I was actually working with a client before I had tried out the ARP that was dealing with some drop foot due to like a L5S1 radiculopathy, low back injury. And when I was working with the ARP and I was getting the training with Jake, we were talking a lot about its success with these types of conditions. And so immediately we're adding that into his protocols with doing the foot bath, doing the low back protocols. And it was just like crazy how fast the results we were getting with him, and he was actually able to come back from it. So that just blew me away. I knew like immediately I was dealing with something that was just definitely worth looking into further. And that foot drop, I was like, wow, because it's kind of hard to say sometimes. Some people respond differently, right, to treatment.
You've had a lot of patients, from what I've seen, actually purchase the smaller one through your office. What do you think the success is with that one?
There's a lot of different ways we use it with the training and during the sessions. Like I have a guy right now, need like both sides, bilateral, this kind of degeneration, bone on bone, if you want to call it. It's been told to get every kind of treatment, surgery, shots, injections, types of thing. And we use it through your traditional rehab, but adding the ARP in to kind of stimulate the muscles to get everything to fire, to get the most out of our sessions. Sometimes after the initial introducing the ARP technology, take it away for a couple of sessions so that they can build that confidence to strengthen on their own, and then use it as more of a way to decrease symptom after training, because there might be some soreness and achiness. And then some of those people just love what we do and want to implement on their own and get the confidence to do it. So they ask about the home device.
Tell us about some other success stories that come to mind.
We were just talking about that guy with the knee pain. He has great insurance. We can go anywhere he wants. And we're out of network here, but he was paying out of pocket just to see us because of the result from this machine that you guys have. And he was struggling just to be able to stand at work comfortably. He was, it was a loss of quality of life at this point. He's, an active dude. And we got him to the point where he actually 2 weeks ago competed in his first jiu-jitsu tournament, took first place in his nice. Age group. Yeah, it's crazy. Nice. And he was going to do another one this week, but we were like, hey, let's back off a little bit.
Okay, so tell us a couple other success stories that you've seen kind of most recent that jump out at you.
My wife she struggles with neck, like disc issues. And there was a lot of time where like when she would just wake up, sometimes her neck would just be super locked up and she would just be working from home for the next couple of days. But with the ARP, she hasn't had that in a very long time. Even for myself, I was using it for like the foot bath for my feet because I was dealing with a plantar fascia issue that was just so much soreness with running, and the foot bath, like my feet feel so light after so much reduction in symptoms.
Tell us some other conditions that you love that walk in the door and you go, boom, love it. ARPneuro, we're going to.
I mean, like anything acute, like it honestly, sometimes when someone comes in with like what we would call a hot low back, where they just hurt their back and they can't stand up correctly, we try to get some positional relief with them and find ways for them to be able to reduce their symptoms on their own so they have some kind of homework. And then when we just apply the ARP technology afterwards, it really helps to make them more comfortable so that they're able to get in these positions more confidently. They're able to, they want to do the homework the next day because they know it's going to lead to getting better faster, and it doesn't miss. You can't really, like you said, it doesn't hurt. They won't hurt them. And with like also a hot like neck, right? Like if someone just tweaked their neck, if you want to call it, and they can't turn their neck and they're worried with driving and whatnot, like ARPneuro is just perfect.
Did it intimidate you? Was it difficult to learn?
No, honestly, it didn't. I just wanted to make sure I tried everything really at like a high level before I put it on anyone, just to make sure
Yeah.
I knew what it felt like. But it was pretty easy to pick up. I was able to apply it pretty quickly because, like I said, you get results really quickly, really fast, and you can feel how it's operating. Like if you put it on your shoulder for a labrum, for example, because I have a torn labrum too, I can't get to a certain, like this is as high as I can get before my arm has to turn out to go higher. And so when I apply the pads on, I can go up pretty smoothly because everything is firing to help that movement pattern go efficiently, right? There's no kind of compensations from the muscle firing pattern due to any kind of injury. Everything is firing at that 500 contractions a second. And I mean, when you kind of think about it like that, where you're placing the pads and what you're trying to accomplish with the session, it's kind of easier to apply. And I still feel like there's so much more I can do with it that I haven't tapped into yet, because I know you guys have so many protocols.
Do you get a lot of referral business because you've had success with this technology?
Yeah, definitely. I mean, we're appointment only, but we definitely get a lot of referrals of people that ask because it's like, oh, someone told me about the shocky thing that was crazy, and it's like changed their life. That's what they say, the electric, shock thing. And I'm like laughing because obviously, that we do our best to educate in the office, but they might be overwhelmed by how all the different things going on. But yeah, we do get a lot of people that get referred in, ask about it.